In this video, I want to talk a little bit about the indications for spinal cord stimulation. Spinal cord stimulation has been around for several years now and is used in a variety of situations. Patients that have lower back pain and in particular nerve pain may be a candidate for spinal cord stimulation. When we see patients, we are typically looking for ways that we can help patients with the surgery, like a laminectomy or a discectomy or a fusion or other type of procedure. Sometimes a traditional surgical procedure is unlikely to be beneficial for a patient. In other situations, a surgery has previously been done and the patient is still having pain. In these situations, a spinal cord stimulator may be considered. There's one unique situation called complex regional pain syndrome, which may be related to a nerve injury or maybe not, but is a unique type of pain for which spinal cord stimulator is actually the best treatment. When we see patients, we again will evaluate them for surgery, and in some cases will recommend that they consider a spinal cord stimulator as a part of their treatment. In our practice, we do not trial spinal cord stimulators. Fortunately, spinal cord stimulators can be trialed. It can be tested to see if it's a reasonable or a valuable option for you. The pain clinics that we work with, most of them do spinal cord stimulation and can trial the implant. So we will send the patient over for a spinal cord stimulator trial and evaluation. Part of that evaluation includes a psychological evaluation. It doesn't mean if you have a psychological evaluation that anybody thinks you're crazy. It's primarily an insurance requirement. However, there is good evidence that cognitive behavioral therapy is helpful for management of pain, and there may be some undiagnosed or undertreated psychological issues that may help you with your pain. Be it as it may, psychological evaluation is almost always a part of the assessment for a spinal cord stimulator. So aside from looking at possible surgical needs and a psychological evaluation, I think it's important that you understand just some basic principles of why we would consider a spinal cord stimulator and what it's intended to do. So a stimulator is an electrode placed into the spine next to the spinal cord. It's actually outside of the covering of the spinal cord called the dura, but inside of the spinal canal, so under the bone. Usually the stimulators are placed through a needle. Sometimes it requires an open incision. In the test for the stimulator, the wire is placed and connected to an outside power source, and a stimulator rep can work with you to trial different settings for a few days to see if it's helpful. The permanent stimulator is placed in the event that the trial is successful or helpful with your pain. The theory is that by modulating the signals going from your arm or your leg, your neck or your back, up through the spinal cord to the brain, the stimulator may change the way that signal is transmitted and may alter the pattern of firing of the nerves by providing a little electrical pulse to the spinal cord. Sometimes that pulse is felt as a buzzing sensation in the area, hopefully, of the pain and is a distracting sensation. Other times, with high frequency stimulation, it is not felt. I think that in your management of spinal care, in the situation where you're in a lot of pain, spinal cord stimulator, unless it's complex regional pain syndrome, is not the first thing that you do. But it is something that can be very helpful for patients that have tried other things for which they haven't seen a lot of great success. And I would encourage you to understand this particular treatment option and talk to your provider about whether or not spinal cord stimulation may be helpful for you.